Hi, I am your registered nurse, Naomi, today, and you must be Susie and Betty Haddo. Nice to meet you guys. So, today I'm going to be teaching you a little bit about your asthma disorder, what it is, the precautions you should be taking, and how to properly use the medication you have been prescribed. So first off, what is asthma? Asthma is an inflammatory disorder of the airways in your lungs. So the pathway that the air takes that you breathe in and the air takes that you breathe out is not as smooth. There's not as much room. It can't flow as easily as it would normally. And this is because a trigger that you breathe in or that your body is exposed to, has a reaction with your immune system, which is more sensitive and makes those pathways in your lungs be more narrow because of certain reasons. So I have a little diagram here from the Lung Association, and we can see here on the right hand side there's a nice big pathway, and then on the left side we can see that the lining is a little bit more swelled up. The muscles have constricted. There's way less room. There might be a little bit more mucus here, and it's so swelled and inflamed. And obviously this makes it harder to breathe. There's coughing, there's wheezing, chest tightness, and you have difficulty breathing, as I already mentioned. And the exact cause of asthma is unknown, but there's predisposing and contributing factors, which include genetically you could be predisposed to having asthma, or if you're more likely to have allergies, that's a big factor as well. There's other things in the environment like pollen, dust, cockroaches, maybe perfumes, mold, very much could cause that as well. Then secondhand smoke, viral and respiratory infections are also a very major factor, especially in children, as you. And so these things should be as much as you can avoided, especially getting the flu shot, avoiding cold air, trying to be inside more than outside, and maybe if you have your windows open or something, try to leave them closed, washing your bedding maybe every once a week or something to make sure that there's none of that dust and pollen in the air. Is very important. And although with those things it should be, or your asthma should be already very much controlled, you've also been prescribed beclomethasone, which is a medication that works by being anti-inflammatory, so the inflammation in your lungs is reduced, as well as the immune system that makes these reactions and causes that inflammation is also suppressed. So all those responses aren't as major as they have been. And the way this is taken is by a metered dose inhaler with a spacer to make the side effects a little less. And what you do is you put the mask on, you press the canister, first you shake it, and then you breathe in and out 6 times. And you should be taking 50 microliters per dose, and it can be taken twice a day. So those side effects include like a dry throat, a hoarse voice, coughing, maybe that kind of thing. And what can help is if you rinse your mouth with water before and after taking the medication. Also, we will be providing you with this My Asthma Action Plan here, and this can help you monitor your symptoms to kind of know if your asthma is under control or not. And in case of an emergency, which can be identified by symptoms like it's very hard to breathe, it's hard to talk, it's hard to walk, maybe your lips and fingernails are getting blue, things like that, you should be going to the emergency right away. And on the way, use your reliever as much as you need to. And yeah, Also, if you have any more questions, you can always refer to the Lung Association in the Brandon Regional Health Center, as well as the Asthma and Allergy Center in the Health and Science Center in Winnipeg. Thank you so much.